video will show you how to transfer a patient on and off the ALTA. Check that the patient is assessed to use the ALTA before transferring. This video shows a stretcher transfer, but you may also be transferring onto a bed or a diagnostic imaging table.
This is the power button, which allows you to log into the ALTA. Here is the handset, which includes the emergency power cut button, the pause button, the play button, and the up and down arrows. This is the calibration button, used after a hard reset of the ALTA. This is the cleaning button, which allows you to clean the belt. The up and down arrows control the height of the platform. These are the transfer on buttons. In the middle is the ALTA. You, the operator, will determine which button you use based on which side the patient is coming from. The play button will be used frequently. If anything gets caught or the system malfunctions during the transfer, use the system pause button. These are the transfer off buttons. The middle represents the ALTA with the patient on board. The system allows the patient to come off from either side. Drive ALTA into the room. Make sure the patient's surface is flat and the brakes are applied. Lower the patient's bed rail and lower the ALTA safety rail. It is released by pulling the grey sidebar underneath the rail. Using the joystick, align ALTA with the patient's surface. Leave a 1-inch space between the surfaces. Apply the ALTA brakes. Check that ALTA is not touching the patient's surface. Raise ALTA 1 inch above the patient's surface. Select and press the transfer on button in the direction the patient will move. Ask the patient to cross their arms if possible. Check that the patient's head and feet fit within the platform length. If the patient is taller than 5'10", you may bend their knees, supporting with a wedge. Press the play button to start the transfer. Press and hold the on-screen arrows to extend the platform close to the patient. This should be around 4 to 5 inches over the patient's surface. It might extend a little underneath their shoulder, but should not touch their hips. Raise any linens, pillows, patient's clothing or equipment lines above the platform so they do not get trapped. Then press continue. Press play. ALTA will now begin surface finding by lowering and compressing the mattress. Continue to check that nothing will get caught between the mattress and the platform. You can inform your patient that they may feel ALTA compress their mattress. ALTA will ask you to confirm surface contact and ensure the moving surface is clear of obstructions. Once confirmed, press play. After pressing play, the platform will extend beneath the patient. Inform the patient what is happening and continue to check that the platform is not pushing or pinching the patient. Remember, if anything gets caught, you can press pause, free the obstruction, and press play to continue. You will now need to visually check that the patient's head and feet fit within the ALTA's head and foot board. Now press the transfer on button for the direction the patient is transferring towards. Followed by the play button, you will need to hold it whilst the platform retracts. As the platform retracts, watch where the platform moves back over the exposed roller. This is a potential pinch point for the patient, linens, or lines. Visually check that the patient is centered on the ALTA. If needed, use the on-screen arrows to center the patient. Next, unlock the ALTA brakes. Use the joystick to move the ALTA away from the bed. Raise the side safety rail and continue to the patient's destination. Drive ALTA into the room. Check that the brakes are applied for the surface the patient is going to be transferred to. Lower the bed rail. Pull the grey bar to lower the safety rail of the ALTA. Use the joystick to move the ALTA close to the bed. There should be a 1-inch gap. Apply the brakes to the ALTA. Raise the ALTA platform height so the belt surface is 1 inch above the transfer surface. Press the transfer off button, selecting the transfer direction. Press play and use the screen arrows to extend the platform by around 4 to 5 inches over the bed. Once you've done this, press continue. Press play to start ALTA surface finding. If anything is caught between the platform and surface, press pause, free the item, then press play to continue. ALTA will ask you to confirm that it's contacting the surface. Check that the ALTA platform is touching the mattress. Visually check that there is no obstructions between the platform edge and the bed surface. Ask the patient to cross their arms. Tell the patient that the platform will now extend them onto the surface. Then press play. Now the ALTA will extend with the patient over the mattress. Check that the patient does not get caught or pinched. Press pause if you see any pinch points, free the obstruction, then press play to continue. ALTA will pause and ask for confirmation of placement. Visually check that the patient is well positioned on the surface, then press play to get to the next screen. Use the right and left arrows to center the patient on the surface if needed. Then press continue. Tell the patient that ALTA will retract. When you and the patient are ready, press play. Unlock the ALTA brakes and use the joystick to move the ALTA away from the patient's surface. Remember to raise the patient's rail. Thank you for watching. For ALTA resources, please check the link in the description box below.